So here's another example of a single leg stance exercise. We're just going to shift our focus on what we're thinking about a little bit. So I'm going to stand on one leg. I'm going to soften my knee a little bit. So now I've got about 15 or 20 degrees of flexion. And I'm thinking about the pelvis in the frontal plane again. And I've got neutral spine. So first, I'm just going to sort of hold this position. This is really sort of a proprioceptive cue to help the patient understand what proper alignment of their leg looks and feels like. One thing I'm looking for here is collapsing of the arch. Maybe the knee starts to buckle in, or I'm watching for dipping of the pelvis in this direction, or maybe they slip into that lower cross position in an anterior pelvic tilt. So any of these deviations I want to try to correct, and I just want to help them maintain this position. It builds endurance, and again, you can use it as a bit of a proprioceptive exercise. Similar to the other single leg stance exercise we did, if the patient's having a hard time with balance, let them hold on to something. If you're not focusing on training their balance and you're just trying to build that proprioception in the lower extremity, you want to have them hold on and not have to think too hard about balance. The next phase of this is to now incorporate a hip hike. So this is an exercise that's pretty popular. The way that I like to tell people to do it is with a soft knee. And the reason for that is if you keep your knee locked out, I think it's a little bit harder to maintain activation of the glute, and there's less to think about in control of the knee in the frontal plane. So now we're really working on the distal end with the foot and the knee, and also the proximal end with the pelvis and the hip. So now from this position, we're in that same position that we started in, and from here they're doing a hip hike. So they drop the pelvis all the way down, push through the right heel on the ground, and bring the left side of the pelvis up in the air. So the point of this is to not crunch with the left side. You don't want to use the left quadratus lumborum to pull the left side of the pelvis up in the air. You want to use the right gluteus medius to push the left side of the pelvis up in the air. So you can see the difference between pulling and really getting a left side bend. And I'm getting a pretty good burn just from doing a few of these right on that right glute medius. So it's a tricky exercise, but these are all these ways to, in single leg stance, not only build some strength and endurance, but also just some proprioceptive control so the patient understands what it feels like to not have deviations in all three planes when the leg is on the ground.